This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Do You Have a Pinched Nerve? With the Back and Neck Pain Center at Mather Hospital, and is sponsored by Jefferson's Ferry. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous as always. Today's presenters are David Ben-Eliyahu, Caitlin Conville, and Zachary Riggio. Dr. Ben-Eliyahu is the Administrative Director of the Back and Neck Pain Center at Mather Hospital and Director of the Mather Chiropractic Collaboration Program. He has advanced certification in sports injuries and pain management, and Dr. Ben-Eliyahu has been in private practice in Selden, New York for 34 years, where he directs an integrated and collaborative spine and musculoskeletal practice. Caitlin Conville is the nurse practitioner and program coordinator for the Back and Neck Pain Center. She received her Master of Science from Stony Brook University after completing their family nurse practitioner program. She joined the Back and Neck Pain Center from the inpatient side of Mather Hospital, where she worked in orthopedics. Zachary Riggio graduated from Stony Brook University, where he obtained his doctorate in physical therapy. Zachary has been a part of the Mather Outpatient Physical Therapy Department for 5 years, and he is also a teaching assistant for the physical therapy program at Stony Brook University. Dr. Ben, if you're on, you could go ahead and get us started.
Okay, thank you very much, Emily. So as Emily described, today's topic is, do you have a pinched nerve? We're going to go over signs, symptoms, home care options, and also treatment options. So next slide, please. So neck pain and back pain, extremely common in society. As a matter of fact, it's probably the #1 source of chronic pain in the United States. It is the leading cause of global disability throughout the world. Currently, 8 or 9 people out of 10 will experience low back pain at some point in their lives. 31 million Americans at this very moment are experiencing back pain, and Americans spend, in this data, about spending $50 billion a year on back pain treatments. It's actually closer to 110 billion per year just in our country. And despite spending that kind of dollars on a back pain problem, unfortunately, outcomes haven't changed that much over the last few decades. One of the biggest reasons is the rate of recurrence. The rate of recurrence for back pain, which is typically from a pinched nerve, is usually 50% within a year, and sometimes as high as 80% within 2 years. The reason for that is because whatever caused the pinched nerve, whatever's causing the problem with the pain, generally hasn't been addressed. And so when the inflammation kind of quiets down and people feel a little better, they haven't done anything different, they haven't changed anything. And we'll talk about some of those examples of what needs to be changed, but the problem comes back. Next slide. So what are some of the symptoms of a pinched nerve? And we'll talk about what a pinched nerve actually is, but here you can see in the neck area, pinched nerves can cause restriction of motion. It can cause weakness in your muscles, can cause numbness and tingling in the hand or the fingers, can cause headaches. It's very common that a cervical or a neck-related pinched nerve or irritated nerve might actually cause headaches too. Those are called cervical-generated headaches. And obviously tenderness to touch, and sometimes even pain down into the shoulder and arm. So these are very common symptoms in the neck area. Next slide. How about the lower back? Well, you can see this poor guy is bent over forward. He's got pain in his back, and a pinched nerve in the back. Some of the signs of that would be pain in the front of your thigh, pain going down to the knee, even numbness or tingling in your thigh, and certainly pain over the hip area with weakness. And it generally hurts all the time, and it sometimes could even throb. It can burn. It could feel tingly or numb. And those are common symptoms of pinched or irritated nerves. Next. So what are some of the everyday and causes and risk factors for a pinched nerve? So obviously stress, poor sleeping posture, poor posture while sitting and standing, any type of trauma, whether it's sports related or a car accident, overuse from working in the yard potentially, bad lifting technique, being overweight, and being out of shape. So stress, some people may say, well, why does stress cause a pinched nerve? Well, stress makes your muscles very tight. And as your muscles become very tight, if we're looking at the trapezius or the neck area, a lot of times when you're under a lot of stress, those muscles become very tight, shoulders become elevated, and muscles attach to bone. They attach from bone to bone. So as those muscles shorten and become extremely tight, they pull on whatever they're connected to. So if they pull on a vertebrae, for example, it can pull on the vertebrae and then actually pull on the nerve, which now might cause irritation or a pinching of the nerve. Next slide. So let's look at some of the things that cause a pinched nerve. So if you look at your top right screen, you can see two vertebrae on a side view. In between the two vertebrae, you can see the disc, that little gray structure that's being circled. And then behind that disc, between the two vertebrae, there's a hole where the nerve actually comes out. Now that hole is not depicted very well because the bones have shifted and actually are causing a narrowing of that hole. And you can see that that nerve is kind of twisted, it's a little compressed, it's red, it's swollen, inflamed, it's irritated. And if you look above and below at the yellow nerves, you can see there's a very different look to those nerves. So a pinched nerve can be from a bone that's out of alignment. It can be from arthritis. You can even see a little bit of some arthritic change there. What else can be a pinched nerve? Well, if you look below it where it says pinched nerve bottom right, very often you've heard the term of a herniated disc. Well, you can see that the disc there that's being pointed to has like a bubble or ballooning out effect. And it squeezes backwards towards where the hole that nerve exits from. And you can see that that nerve is being pinched. The nerve is red, it's swollen. And this is very common with herniated discs. And if anybody who's listening has had a herniated disc, you can attest to the fact that it's extremely painful in the back. But not only that, it can actually cause pain to shoot along the course of that nerve, and in this case, in the lower back, the sciatic nerve. So let's jump up to the left top picture where it talks about sciatica. So again, you can see the top right picture there, the disc material. I often refer to that like a jelly donut. The jelly has moved from the middle, it's squished out to the side, it pinches the nerve, and now it can cause pain in that nerve. And then you see where it says sciatica and the leg is red? Well, that sciatic nerve goes all the way down the leg. So if the nerve is pinched at the spinal area, it can actually cause shooting pain down into the leg, and that's a sign of a pinched nerve as well. Lastly, in our older population of people, you can get something called spinal stenosis. Now, spinal stenosis means that we've developed arthritic changes, and this is the most common scenario because people can be born with congenital spinal stenosis, but that's not common. The most common thing is as we get older, we get wear and tear in our spine, we develop arthritic changes. The canals where those nerves come out become very small. So if you look at the left picture, which is a cross cut through the vertebrae and the disc, the left picture shows big, thick yellow nerves. The opening where the bones are is nice and open. Compare that to the blue picture where you can see that the opening or the canal, the central canal and the nerve canal have become extremely narrowed and the nerves get pinched. So spinal stenosis can cause pinched nerves. Disc herniations or bulging discs can cause the nerve to get pinched. And even just the vertebral misalignment or arthritis in the spine can cause a pinched nerve. Next. So how do we diagnose this? Well, besides taking an accurate clinical examination and doing a comprehensive exam, we generally use diagnostic imaging. So if you look at the far left picture, where the two red arrows are, you can see that the disc has become extremely narrowed compared to the one below it. The other thing you can see that the arrows are pointing to are this overgrowth, these bony spurs. Now, the hole where the nerve comes out is right where that right red arrow is. So if that hole is becoming narrowed, it can definitely cause the nerve to get pinched. Go to the far right picture and look at the white arrows, and it's pointing to the hole that has become extremely, almost like somebody pinched it. So if you look at the hole above and maybe two holes below, you can see that the hole is nice and oval, very open. And the nerve opening has plenty of room for that nerve to pass through. Now picture the nerve passing through that hole where the white arrows are pointing to. The nerve has to be pinched at that level. The middle picture is showing MRIs, and you can see that the arrow is pointing to a herniated disc. What the MRI in this particular case isn't showing is where the nerve opening is, but that herniated disc has slipped out and it's right by the nerve root, causing the nerve to get pinched. We couple imaging along with our history and physical exam, and it does a great job of helping us make the diagnosis of pinched nerve. Next. So what are some helpful tips to minimize pinched nerves? So obviously sleeping better. So how should you sleep? Well, sleeping on your stomach is never good for a pinched nerve if you have one, and can oftentimes cause a pinched nerve. So the best position to sleep is sleep on your side with a pillow between your legs, or on your back with a pillow under your knees, and make sure that your mattress is not old and saggy. Mattresses generally last about 10 years. I'm not going to get into which mattress is best, but having said that, if your mattress is 20 years old, rest assured that that's not contributing to good sleep and probably contributing to a pinched nerve. Check your posture. Posture is extremely important. In today's day, especially with COVID, a lot of us are working from home, working on our computers. Our sitting posture has become very poor. And as a result, it causes nerves to become pinched because our bones have shifted forward. And very commonly, another reason for postural change in pinched nerves, that when you're working on your phone, instead of looking at your phone up here and texting, a lot of times what we tend to do is look down, and that's actually called text neck. So posture is extremely important, not just when you're sleeping, but also when you're sitting at your desk and when you're standing. We'll talk about therapy, physical therapy, chiropractic therapy later. Medicines such as over-the-counter things like Tylenol and non-steroidal anti-inflammatories can certainly help. Stretching and exercise, the physical therapist is going to get into the importance of stretching and exercise, because that can alleviate pinched nerves and alleviate poor postural problems, and prevent pinched nerves from ever happening. But if you do have muscle spasm, if you are experiencing pinched nerves, in the beginning, always use ice and then transition to moist heat. Try to avoid using dry heating pads, because dry heating pads, they don't conduct the heat deep into the tissue that needs it. It's basically just superficial heat. Next slide. So at home, obviously rest, avoid pain-causing activities, especially if you're having a problem. Always use ice in the beginning to reduce inflammation. And ice has a threefold effect. It reduces inflammation, it actually reduces pain because it's analgesic, and it also reduces muscle spasm. Take a good look at your posture. If you look at yourself on the side view in your mirror and you tend to be slouching forward and your head is forward, you have to correct that. And the same thing with seated posture. Those forward maneuver postures cause a lot of stress. In fact, if your head shifts 2 inches away from the midline, it's as if you put a 20-pound weight on your head, and that 20-pound weight every day, 24/7, trust me, will lead to a pinched nerve. If you're sitting and you're forced to sit because your job, you have to sit at your desk and work 8 hours a day, you need to get up frequently, at least every once an hour, if not every 20 minutes. Take time to stretch, use heat in the chronic stages, but make sure it's wet heat, and then obviously over-the-counter Aleve or Advil sometimes is helpful. Next. So we talked about posture. We'll just go over that quickly again. If you look at the top picture, you can see correct posture. Her head is centered over her shoulders, over her spine. And if we drop the plumb line from the head down, it would be perfectly straight. The posture I was just referring to, where the head is forward, the upper back is forward, like a forward kyphotic posture, that puts a tremendous amount of stress on the neck bones, on the mid-back bones, and will always lead to muscle spasm, and will always lead to mechanical stress that will lead to pinched nerves. So middle picture is talking about seated posture. Look at the left picture, that rounded back, head forward. We just talked about that. Obviously, the way to combat that is if you put a box under your feet, it forces you to be more erect, and make sure that the monitor is at eye level. Take a pillow or a roll towel and put it behind your back to give your back proper support. And then sleeping posture, which is equally important. We talked about this before. Put a pillow below your knees if you're sleeping on your back, or a pillow between your legs when you're sleeping on your side. Next slide. Exercises, just briefly, exercise is critically important. Exercise is medicine. If you're sitting all day and working, if you're inactive, you're not walking, you're not stretching, you're not doing some type of muscle activity, muscles will atrophy, get weaker, get smaller, and they no longer support the spinal structures. And as a result, any type of stress on those joints or discs will lead to pinched nerves. So you have to start exercising. You have to start moving. Motion is exercise. Motion is critical for preventing musculoskeletal problems, spinal and orthopedic problems. The physical therapist will get into this a little more. Next. So let's take a moment. By the way, I think there are some questions. We'll take questions at the end, and the appropriate provider will answer each of those questions. So go ahead and type it in on your bottom. You'll see on the bottom of the screen, there's a Q&A section. But at this moment, what I want everybody to do is take a moment to score this functional index. So when I talk about function, I'm not talking so much about pain as I am about activities. As providers, we are required to report not just your pain levels when we're reporting to Medicare or insurance companies to treat someone. They also want to know about function. What's your functional disability? How is it affecting your life? So function is critically important, because if you can't do the things you like to do, whether it's work, whether it's a hobby, taking care of your children or grandchildren, playing golf, sewing, knitting, doing gardening, it makes your life and the quality of your life decrease. So everybody, we're going to stop for 30, 40 seconds. I want everybody to take a look at this. Give yourself 1 point for every one of these that you check off. We call this an Oswestry Disability Functional Index, and we actually report this to insurance companies in the beginning when we're treating someone, and then we actually do it in follow-ups as well. So we'll stop for 30 seconds, just take a quick look, get an idea of what your score was, and then I'll address this again at the end when we're closing, and what the importance of this is, and how this affects the quality of your life. As you're doing this, if you wouldn't mind, in the Q&A section, just type in a number, what your number is, so I can take a look at it as we're talking. And we'll come back to that at the end. So if your score was 2, if it was 0, if it was 10, whatever it was, just throw that number in the Q&A section. And you're more than welcome on a separate one to just write down what your question is, and we'll address those at the end. Okay, so let's move on. So what kind of treatment, if you have a pinched nerve and it's not getting better on its own, maybe something needs to be done. And there are several types of providers and treatments that are capable of handling pinched nerves based on severity, based on chronicity, and urgency. Chiropractic care is one of them. Physical therapy is another. Acupuncture and massage therapy. Sometimes it's so bad that patients need to get interventional injections. And last but not least, spine surgery if nothing has worked and everything has failed and somebody's not getting better. Next. So we're going to talk a little bit for a few minutes about these options, physical therapy and chiropractic medicine. I'm a chiropractic physician in training, and I'm going to talk about what we do to offer people with pinched nerves. And then our physical therapist here at the hospital will talk about what they do. Next. Next. So for those of you who have never been to a chiropractor, chiropractors specialize in the musculoskeletal system and the spine. We don't prescribe medication. We do comprehensive examinations. We order imaging. And for those of you who don't know this, chiropractic recently in the last decade has had a plethora, a significant amount of research studies that have been done that have, and controlled clinical trials that have shown that chiropractic should be in the first line of therapy for back pain and pinched nerves. And this comes from the American Medical Association, the FDA, the CDC, and even the Joint Commission of Hospitals. Chiropractors do rehabilitation, recommend exercises, talk about posture like I talked about today. And we have a lot of chiropractors that Mather Hospital has vetted that have been found to be really high quality chiropractors. Next slide. So here are some of the things that chiropractors do. For those of you who have been to a chiropractor, you may have experienced some of these things. The top left picture and the top right picture is the chiropractor is actually performing spinal manipulation, where people refer to this as cracking the back, so to speak. And by the way, if you didn't know this, the noise when someone gets a manipulation, that noise is nothing more than just gas that's released from the joint Nothing cracks, nothing breaks, nothing snaps. It's as if you opened up a soda can and the soda can popped. It's the same thing. Pressure releases makes that noise. However, having said that, this particular technique is not good for everybody. It's good for uncomplicated back pain. It's good for younger populations of patients who don't have spinal stenosis, inflammatory arthropathies, osteoporosis. These things I tend to avoid and don't recommend for those types of class of patients. So what do we do for those patients? Well, if you look at the bottom pictures, this is called a Cox table. When you look at the bottom right, bottom left, it's a table that moves up and down and back and forth. And it's a very gentle way of distracting the joints and distracting the disc without actually doing that type of a crack manipulation, again, which isn't good for everybody. But this helps, and it's a great adjunct for treatment, and it works extremely well. The far left picture is a mechanical tool that pulses the joint. It helps to cause realignment. It stimulates the joint to stop muscle spasm. And it's also a very gentle, non-forceful way of doing manipulations. Next slide. Chiropractors do physiotherapy, therabands, recommend exercise. Many chiropractors are dual licensed in acupuncture. So chiropractors do a lot of different therapies when they're treating their patients. Next. Here, this is actually the doctor on the left is demonstrating the Cox table. The table moves up and down as the spine is stretched. Same thing on the top right. The neck is moved up and down. And then you can look on the bottom before treatment and after treatment. This is a patient that actually had a herniated disc. This is a paper that I published several years ago. And if you look at the left picture, you can see that the disc is clearly sticking out. And then if you look at the right picture, you can see that weeks to months later, when the MRI was repeated, the disc herniation actually resorbed and disappeared. Next slide. And this is actually the paper that I published. And you can see, again, the top picture, the significant disc herniation does resorb. So once a herniated disc, not always a herniated disc, and herniated discs don't always need to have injections or surgery. They respond really well to this type of Cox table treatment. Next slide. And lastly, on chiropractic, and we'll move on. It's gone full circle. If you had asked the AMA about 20 years ago, should I go see a chiropractor? The answer would have been a resounding no. They can hurt you, it's no good for you, et cetera, et cetera. However, in the last decade, so much research has been done. And the most recent study actually compared military GI personnel that went to the VA for chiropractic treatment, and they compared that to people who got standard medical care. Hands down, the people who had chiropractic care and medical care together did much better than medical care alone. Next slide. So I'm going to introduce Zach Riggio. Zach Riggio is our physical therapist here, and he's going to talk about the importance of exercise and stretching, on how that helps prevent the pinched nerve from ever happening, and also how it helps once a pinched nerve occurs. Zach?
Hey, thanks, Dr. Ben. How's it going, everyone? Thanks for taking your time out of your day to spend it with us. My name is Zach, one of the PTs here at Mather Hospital. Work very closely with Caitlin and Dr. Ben in the Back and Neck Pain Center. So we're very familiar with treating people with, pinched nerves, back, neck pain. So definitely something we see a lot. So as Dr. Ben already told you, he spoke a lot about symptoms of pinched nerve, kind of what causes a pinched nerve. So I won't go too much into that, but from a clinician standpoint, pinched nerve can also be referred to as a derangement. And now, what's a derangement? It sounds like a really scary thing, right? It's basically just a category where people with pinched nerves, sciatica, pain down the arm, back pain, neck pain, they kind of are grouped into for us to better assess and manage them, okay? And a derangement can also be considered mechanical pain, right? So it can be local, just at the neck or back. It can be radiating down to the leg or down to the fingertips. It can be constant. It can be intermittent. You could have both neck and arm pain, or both back and leg pain, or it could be numbness, tingling, or weakness. So any of those things are possible and things we see. So if we go back to the previous slide, I'm sorry. So basically with mechanical pain, what are we seeing, right? We're seeing symptoms that will change. They're variable symptoms. You have good days, you have bad days, right? There's days where you feel it, days where you don't feel it as much. That can be a good thing, because it means it's amenable to change, right? With certain movements or positions, it can become better or it can become worse. So if we go to the next slide, how do we do this? We do this with the use of, it's called the McKenzie method. So also called MDT, Mechanical Diagnosis and Therapy. It's an evidence-based, effective approach to treating pain in the spine or related to the spine. And it's used all throughout the world. It's taught and used pretty much in tons of different countries. Very effective, very systematic approach, which many of the therapists here use, and makes it easier for us to transition from one therapist to the other pretty seamlessly and being able to know where the other one left off. The rest of the points will come up again in a later slide, so I'll go over those in a few minutes. Next slide, thank you. So what happens during the examination, right? Dr. Ben talked a lot about posture and how it can be a cause of the development of your pinched nerve or your symptoms. And it can also be a reason for reoccurrence of those symptoms or re-aggravation of them. So definitely something we look at. We want to look at your posture, what your spine looks like in sitting, standing, all those things. Neurological testing would be done, as needed. If you're coming in with pain or numbness into the hand or leg, weakness, those are all things we want to take a look at and get solid baselines of so that we can determine if they're getting better or not. The next thing we'll do is we'll assess your range of motion for a movement loss. Many people with pinched nerves or back or neck pain, going into the extremities, they're going to have some form of motion loss within the spine, whether it's, you feel like you can't bend forward to touch your toes, or you can't turn your neck when you're backing up out of the driveway, or you might not even notice it. It might seem like stiffness within the spine. So those are all possible things and things we want to look at to determine where we're going to go next with the repeated movement testing. So repeated movement testing, we're basically going to put you into one position or have you do one movement in order to test how you respond to it. Basically, what we're doing is we're trying to find what they call your directional preference. Now, this is just a position or movement that we're going to put you into that best relieves your symptoms or takes the pain up out of the leg or out of the arm. If we move on to the next slide, you'll see in this picture, it talks about centralization. Now, centralization is a phenomenon that occurs where you can see on the left side of the picture, there's the line going all the way down to the leg, right? That's to represent the pain, numbness, tingling. As you move from the left side of the picture to the right, you'll see it comes up out of the leg and centralizes into the middle of the back. And eventually that pain or numbness, tingling, it will go away from the back too with further treatment. And again, we do this using the McKenzie method and through repeated movements to try to find that directional preference. And the repeated movements are used not just for the assessment, but also for your management. So many times what is going to help you in the clinic and relieves your symptoms in the clinic is what you will go home doing as kind of a home exercise program. There's a big emphasis on patient independence because, Dr. Ben talked about the high recurrence rate, right? We're not always going to be there with you, or if it's down the road and it happens again, you need to know how to manage these things and how to get rid of it on your own. Postural correction. Again, he talked about how important posture is, avoiding certain postures to avoid re-aggravation of your symptoms. Next slide. So management. Again, we're trying to find that directional preference, that one position or movement that's going to best relieve your symptoms. Again, this is an exercise or position that you're going to do every couple of hours. Every 2 hours, you're going to do 10 of them. Now, I know that sounds like a lot, but it could take 30 seconds and that's it. And you go on about your day, usually not that strenuous. And then you just continue on about your day. And now, why do we have you do it every 2 hours? It sounds kind of crazy, right? But the reason we have you do it every 2 hours is because you're a dynamic, moving, living being, right? You don't just spend all day in bed and don't move. You're bending forward, you're lifting up your kids, you're doing yard work, you're driving to work. All these positions and movements may cause aggravation of your pain, and therefore you have to have a technique and something to do in order to relieve those symptoms, kind of interrupt the pain loop that happens. Again, you're going to want to avoid those positions that increase your symptoms. We're going to focus on postural correction. Sometimes, like Doctor said, you might have to roll up a towel or something, put it in your lower back, just to help keep you in a good, solid, neutral spine to prevent anything, especially in the beginning when your symptoms are very acute. We're going to use a combination of postural and core muscle strengthening exercises, bending, lifting techniques, because we don't just want a mobile spine, we want a strong, resilient spine that's going to be able to combat any future problems in the future. Recovery of function is basically when we get to the point where your symptoms are well managed, you're feeling pretty good, we slowly begin to reintroduce range of motion into all those positions that initially caused you pain, right? So it's not that you can never bend forward again, or it's not that you can never pick up your kids again. just in the acute phase, we want you to avoid it. Eventually, we're going to get you back to doing those things pain-free. And then you'll continue with this home exercise program in a prophylactic manner, right? So you might not do it every 2 hours. You might just do it once or twice during the day to prevent any kind of recurrence. And then once you understand how to manage your symptoms, that's the key. That's what we really want to teach our patients, because once you learn how to do that yourself, you're good. You can prevent that high recurrence rate, that over 50% that, if you had neck or back pain previously, you're going to be able to manage your symptoms on your own and hopefully prevent it from ever happening. That's one thing we also teach people, is to know when their back or neck is going to go out, to learn the symptoms out, before it even happens. So hopefully we get to see you guys in the clinic and help you out. Thanks for watching.
All right. Hi, everyone. My name is Caitlin Conville, and I'm the nurse practitioner at the Back and Neck Pain Center. So today I'm going to tell you a little bit about the Back and Neck Pain Center here at Mather Hospital, just our approach to treatment. And I'm also going to speak about some healthy lifestyle factors that can help with back and neck pain. And I'm also going to talk about some of the other treatment options when physical therapy and chiropractic treatment don't alleviate your pain. Next slide. All right, so how is the Back and Neck Pain Center different? So here at the Back and Neck Pain Center, we provide evidence-based multidisciplinary care, which is customized by a clinical team consisting of a collaborating physician and guided by myself, the nurse practitioner. So when I talk about multidisciplinary care, again, I'm referring to the fact that we have multiple providers from many different disciplines, and that includes spine surgery, interventional pain management, physical therapy, and chiropractic, and we all work together to coordinate your care. So we meet once weekly, and we review patient charts to allow for providers from different backgrounds to weigh in on the selected treatment plan, and then they can provide their unique perspectives. At the Back and Neck Pain Center, we also aim to reduce recurrent episodes of back and neck pain in the future, and we do this by teaching about adopting a healthy lifestyle. We also avoid the use of high-risk pain medications here at the Back and Neck Pain Center. So while one of the goals of treatment is to alleviate your pain, we also want to find the underlying cause of your pain and provide treatment that addresses this underlying cause. And then at the Back and Neck Pain Center, we also identify and address disparity of care factors. So there are a lot of factors that make it really difficult for individuals to access treatment. And this includes things like financial obstacles, transportation issues, mobility issues, comorbid medical conditions, mental health issues, and difficulty managing multiple appointments with different providers. So here at the Back and Neck Pain Center, we aim to identify these factors and provide assistance just to make sure that you're getting the treatment that you need. So the stepladder approach. So this graphic depicts our approach to treatment here at the Back and Neck Pain Center. So we use what we like to refer to as a stepladder approach. And with this approach, we aim to provide the least invasive, effective treatment option for your condition. So for most people, that means starting with conservative treatment measures such as physical therapy or chiropractic care. Now, if you've already tried conservative measures without improvement, or if your condition warrants further intervention, we may start a little bit higher on this ladder with something like pain management or one of our support programs. In cases where you have red flag signs or symptoms that indicate an urgent condition, we may send you directly to a surgeon. So statistically, approximately 75% of our patients improve with conservative measures, but we continue to evaluate you throughout the course of treatment and then recommend any additional treatments or steps as appropriate. About 20% of our patients utilize our pain management treatment options, and about 5% of our patients have required spinal surgery. So our overall goal is to provide you with the most appropriate treatment and treatment that will be effective in reducing your pain and will help you to regain function. Next slide. All right, so the role of diet and nutrition in back pain. So on the left here, we have examples of foods that are not the healthiest foods in the world. So foods that promote inflammation in the body and promote weight gain while providing very few nutritional benefits. And here on the right, you can see that we have fresh, colorful produce, foods high in antioxidants, vitamins, and minerals that actually serve to reduce inflammation in the body. So research shows that our diet plays a significant role in inflammation and pain in the body, particularly when someone is experiencing pinched nerves in their neck or back. So inflammation is an important underlying mechanism for the development of chronic disease, and that includes things like type 2 diabetes, heart disease, arthritis, and cancer. But increased inflammation in the body is also found in patients with chronic pain. So by recognizing foods that can reduce inflammation, such as plant-based foods, as well as those that promote inflammation, we can make diet modifications that can decrease inflammation in the body and then help to reduce your pain. Next slide. So the anti-inflammatory diet. So here on the left, you can take a look at this. We have the food pyramid for the Mediterranean diet, which is an anti-inflammatory diet that provides excellent guidelines for how to make diet modifications that will reduce inflammation in the body. So inflammation in the body, like I said, can either be positively or negatively affected by the foods that we eat. So pro-inflammatory foods, or foods that increase inflammation in the body, include things like saturated fats, which can be found in meat, especially red meat, and whole fat dairy products. Trans fats, which are found in hydrogenated oils that are used to make packaged or processed baked goods and crackers. Omega-6 fatty acids, which are found in oils such as corn oil, safflower oil, soybean oil, and in sugar and sugar-laden foods. Whereas anti-inflammatory foods can help to reduce inflammation markers in the body. And these include foods high in omega-3 fatty acids, and those are found in canola oil and walnuts, monounsaturated fats, such as olive oil, peanut oil, nuts, and avocados, and fruits, vegetables, and whole grains. The more colorful, the better, and also many different herbs, spices, and teas. All right, so treatment for pinched nerves that don't respond to conservative non-invasive care. So sometimes we try all of the conservative options available to us and you still have pain. So these are some of the options that we can pursue if you're not improving with conservative measures. So one treatment option available is that of facet blocks or ablations. So this is a treatment option that best treats axial pain or pain in the back or neck that does not radiate. So typically the first step with this process is a diagnostic nerve block known as a medial branch block, and this can relieve pain temporarily. So we actually use this as a diagnostic tool. So if your pain is relieved, this lets us know that the blocked nerve was the nerve causing you pain. So if we successfully identify this nerve, the next step would then be something called a radiofrequency ablation. And that involves the use of heat to stop the transmission of pain signals involving that same nerve. So these procedures are done by interventional pain management providers. They're minimally invasive, performed on an outpatient basis, and they're X-ray guided to ensure precision. Another treatment option is that of epidural steroid injections. So these are steroid and anesthetic injections that are injected into the epidural space, which they result in the reduction of inflammation and pain. So these injections are typically indicated for the treatment of radicular pain, or pain that radiates into the arm or the leg that you see in something like sciatica. And finally, there are surgical options available for treatment of pinched nerves that don't respond to conservative treatment measures or any of the interventional pain management procedures that we listed above. So surgery is typically reserved for instances when non-operative treatment options have been exhausted, or in instances when your condition is unstable or progressive in nature. So some indications for spinal surgery include emergency conditions such as bowel or bladder incontinence or retention, which can indicate a very, very serious condition known as quad equina syndrome, severe muscle weakness, or if there are imaging or exam findings that indicate that you may have spinal cord compression. So these are just some of the things we look out for during an exam. Certainly, if you were to be examined here or by another provider, they would look out for these red flag signs or symptoms, and those would be an indication for more emergent treatment. Next slide. All right, so now I'm going to hand you back to Dr. Ben Eliyahu, and he's just going to review the results of your back and neck pain risk assessment with you.
So some of you went ahead and actually did this. And so you can see that if you scored a 2 or above, like the people that scored 0 and 1, those generally signify that the condition or whatever you're feeling, you can certainly manage that on your own at home, utilizing some of the tools that we've given you today, change your diet, lose weight, correct your posture, strengthen your core. But people who had like 7 and 5 and 10, those are significant numbers. That means it's affecting the quality of your life and your function. And that generally requires somebody to help you move you along and get you better. I think we did a decent job of, we're going to take your questions and answer them one by one in a second. But I just want to let you know that here at the Back and Neck Pain Center, it's a comprehensive program. We accept almost every insurance. We even have telemedicine available. Caitlin Condell, you just saw speak. She's our nurse practitioner coordinator. She's the point of contact. She kind of holds your hand through the whole process, getting your records, setting up appointments if you have a pinched nerve that's non-responsive. So if you feel the need that you're not getting better, you have a chronic problem, I think you'd be well served coming to our center. We take most insurances, as I said. And next slide. And that's just the, well, by the way, one of the questions was, how do you make an appointment? And will we send you a copy of this PowerPoint? Yes. So afterwards, our staff will actually send everybody that attended today a copy of this. All right, so let's answer questions. And I'll take a look at the first one. First question was, I have 2 pinched nerves in my neck and in my back. It affects my arm. I get extreme pain when I stand. What can I do? Doing PT, nerve meds, and muscle relaxers. So if you're going to physical therapy and you've had medication and you're taking muscle relaxers, you're not getting better, that means that maybe the problem hasn't been identified properly. And, when we take personal questions like this, it's tough because we don't know what the background is. Have you had imaging? Have you had an MRI? Have you had x-rays? So certainly that's something that if you have a chronic problem that's non-responsive to the mode of therapy you're using, I would recommend you take down that number and come in and see Caitlin, and let's figure out what's going wrong. Next question further down, I think same person. Are there Northwell and Mather chiropractors on the East End? There are. We have chiropractors out in Riverhead. I think in Manorville as well. So there are, and if that's what you need, again, you can access us for that information. Next question was about the Cox table. Does a Cox table be used on pinched nerves? On a person who has scoliosis, yes. One of the things I couldn't show you is that the Cox table not only goes up and down, back and forth, it actually rotates sideways. So it can actually help derotate a curve and put the patient in the proper position to access whether it's a pinched nerve or a disc herniation. So the Cox table is probably the best way to treat someone with a scoliosis who's having other issues. So how do I alleviate pain in my neck? How do you treat an arthritic neck? Zach, why don't you take that question?
Sure. Yeah. So my question is, with arthritic pain, do you really know if it's the arthritis causing your pain? Sometimes, like I said, you have variable pain. Some days it hurts, some days it doesn't. Usually arthritis doesn't turn on and off, right? Like it doesn't go away, where you don't have any symptoms. So sometimes it can be something else causing it. It could be a disc, it could be a joint. So it really depends on what's actually causing it. If it is truly an arthritic problem, a lot of times, like Dr. Ben said, just movement and general exercise can be very effective for treating that.
Caitlin, you want to add anything to that?
No, I agree. A really good evaluation is important to make sure that we're treating the correct cause of pain. But certainly conservative treatment measures can be helpful with pain caused by arthritis if that is the cause of the pain. I did want to mention, I just noticed on the last slide, just to everybody listening, just to let you know that we have updated our insurance providers since, and just that we do currently take workers' compensation now, just if anybody was wondering about that.
The last question here is, can the Cox table work in the neck area? Emily, if you would go back to the section where we had the Cox table, I can demonstrate that. The answer is yes. So the next one, right. So if you look at the top right-hand picture, you can see that the doctor has his right hand on the device at the top. His left hand is over the neck area. So just like the table moves up and down in the lower back, the headpiece will move down in flexion and extension. And what it does is it separates the disc space, and it also helps to open up the nerve openings where the nerve is being pinched. So it has a twofold effect. It increases the space between the vertebrae to unpinch the nerve, but it also has an effect on that disc. So if that disc is bulging, it's almost like decompressing the disc, or picture an overinflated balloon. It's similar to deflating the balloon and getting, like you can see on the MRI on the bottom, get the disc to go back into where it belongs. Are there any other questions? We'll wait a few more seconds to see if anybody else has a question while we're doing that. If you have a problem, feel free to give us a call. We're here to help you. We poll our patients regularly, and we have very high satisfaction ratings, not just in the center itself, but also with the providers that we refer to. I think, any more questions?
Yeah, looks good to me, Dr. Ben. I just want to say
Okay.
thank you so much, everybody, for joining us today. Thank you to Zach, Caitlin, and Dr. Ben Aliyahu for taking the time to present. If you guys will get a copy of this presentation via email, and you'll also get a link to complete a brief survey. If you could just fill that out, it really helps us with certain, back and neck pain topics you'd like to hear about, or even just health topics in general. And thank you again, and everybody enjoy the rest of your day.
Thanks for attending. Have a great day.